Hey everyone, Dr. Dale here. I want to discuss vaccines again because I just pulled a poster or a picture off of the internet brought to you by UNICEF advocating for the use and use of vaccines around the world. They want to vaccinate every single child and in hopes that they would reduce infectious disease death rate. So real quick, the numbers here, and I want to give you a comparison here. Where should we really put our time, our effort, and ultimately our money into this to save lives? If we're really about saving lives, there's a better place to focus right now. If you take the numbers they wrote down here, you've got 199,000 deaths from influenza type B around the world, 195,000 from pertussis, measles, 118,000, and so on. So adding that up to 1.5 million children or individuals dying from those infectious diseases every single year. Now that number right there, compare it to this one. Malnutrition, poor sanitation. And I note that because ultimately these numbers right here would not matter if we would take care of that right there. If we would take care of malnutrition and poor sanitation, we wouldn't even have to worry about the death rate of infectious diseases. Because the largest historical decrease in deaths caused by infectious disease was not from the modern antibiotic and vaccine era, but from the introduction of clean water and effective sewer systems. That's according to Lancet 1977, Department of Community Medicine. So right there, we wouldn't even have to worry about that if we focused here. But take these numbers. 925 million people are undernourished worldwide right now. It's the number one risk to global health. And 3.5 million children under the ages of 5 die every single year from malnutrition. And malnutrition directly influences whether a child dies of this. See, according to Myron Levine, who is the director of the Center for Vaccine Development at the University of Maryland, he says that vaccines fail to work in children in developing countries. Polio, rotavirus, cholera vaccines fail in patients in India, Brazil, Peru, and Bangladesh, and other countries where sanitation lapses. So without sanitation and clean water, the vaccine doesn't even work. In fact, they documented that a child can be vaccinated 15 times with the polio vaccine, and it doesn't work to prevent them from contracting and developing polio. Without sanitation, they don't work. Vaccine failure is particularly problematic for polio, despite being the focus of one of the most expensive public health campaigns in history. $9 billion has been spent just on polio vaccines alone. And yet in these countries where good nutrition and good sanitation isn't existing, then those children don't even benefit from the vaccine. We must bring them this. We eradicate these numbers and we take care of those at the exact same time. Because if you're eating a healthy diet, if your body is not lacking nutrition, and if you're not living in filth, then these infectious diseases don't harm you. That's the fact. So what I want to ask is, why not use something like nutrition and sanitation that will kill two birds with one stone, or rather it'll save two lives with one stone, than use vaccines that currently aren't even working? You know, what makes sense to you and what makes common sense? I'd like you to be the judge.